Hi, and welcome back to Among Therapists, Practical Tips by Psychotherapy Academy. I'm Dr. Jessica Díaz, your guide in this journey towards enhancing your therapeutic skills. Today, we dive into the 11th episode of our series, The Middle Path for Trauma Work, a dialectical behavioral training. In this insightful session, we unravel the foundational dialectical dilemma in DBT, the balance between acceptance and change. We'll explore how these seemingly opposite concepts are crucial in the treatment of trauma and how they can coexist in therapeutic practice. Our faculty member today is Dr. Kirby Reutter. Dr. Reutter is a bilingual clinical psychologist who contracts with the United States Department of Homeland Security to provide treatment services for asylum seekers. He is a TED speaker and the author of the Dialectical Behavior Therapy Skills Workbook for PTSD, Practical Exercises for Overcoming Trauma and Post-Traumatic Stress Disorder. We're excited to announce that this extract is part of our new trauma training pathway, Proven ACT, DBT, and Prolonged Exposure Techniques. Embark on a journey to master trauma therapy through various evidence-based frameworks. This training program emphasizes practical knowledge, allowing you to transform these theories into actionable strategies for effective trauma treatment in complex scenarios. Enhance now your trauma therapy skills with our three-dimensional e-learning program and earn up to 30.25 CE credits. Without further ado, here's Dr. Kirby Reutter.
Welcome to the 8th video in this module. In this video, we will examine the most foundational of all dialectical dilemmas in DBT, the dilemma of acceptance versus change. So let's get started. In a previous video, we have already introduced the idea of dialectics. So if you recall, dialectics is this concept borrowed from philosophy, and it has to do with this whole idea of bringing together opposites or looking at things from new or different perspectives. It's especially all about this idea that two things that seem like opposites can both be true at the same time. In this video, we will focus on the main dialectic within DBT, acceptance and change. On one hand, trauma survivors desperately need to be accepted. Why is that? Well, just think about their extensive histories of invalidation. Remember, trauma is invalidating, and invalidation is traumatizing. But on the other hand, trauma survivors also desperately need to change. Why is that? Well, because their symptoms feel like a personal hell. And not only that, their coping styles, remember, too much and too little, are making things even worse. So now what? We don't have the luxury to choose between acceptance or change, since clients need both. Therefore, we give them both. You can think of acceptance and change as two sides to the same coin. The more we accept a client, the more we also help them change. And the more we help a client change, the more we show that we accept them. You can also think of acceptance as often a prerequisite to change, because you can't change something that you haven't accepted yet. Remember this whole idea of Hegelian dialectics that we talked about earlier, thesis, antithesis, and synthesis? This completely applies to the evolution of DBT. Think of behaviorism as the original thesis, this focus on changing behavior. Think of humanism as the antithesis to that. Humanism focused on acceptance. Well, DBT is the synthesis. DBT is this unique hybrid of both emphases, change and acceptance. And fortunately, acceptance and change are both built into the model itself. For example, mindfulness and distress tolerance are acceptance skills, because with both mindfulness and distress tolerance, you're not trying to change anything, you're simply trying to accept. Then on the other hand, emotion regulation and interpersonal effectiveness are change skills, because we're teaching clients these skills to really help them change. In other words, learn new ways of dealing with life. And of course, it takes dialectical thinking to balance both acceptance and change. So that's all 5 of the skill sets that we've mentioned previously. Of course, from dialectics, we know that both acceptance and change can both be operational at the same time, because dialectics is all about bringing together things that seem like opposites. There is no correct balance between acceptance and change. On one hand, acceptance and change, they're not mutually exclusive, but on the other hand, there will not always be a nice, clean harmony between these two competing needs. So the ratio between how much acceptance and how much change a client needs is in constant flux. And it'll depend on any given client and any given situation. Therefore, it requires clinical judgment on the part of the therapist. It also requires attunement to the client and their ongoing needs. So when in doubt, when you don't know how much acceptance or how much change to focus on, you can follow this formula. Validate, 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 skill. But what if you're working with a client that is stuck on either acceptance or change or both? Well, something that can be helpful is the stages of acceptance that we've all heard about. Denial, anger, bargaining, depression, and acceptance. Or the stages of change that we've all heard about. Pre-contemplation, contemplation, preparation, action, and maintenance. Did you notice that both of those models have 5 distinct levels of change? When I'm working with a client and I'm not quite sure where they're at with acceptance or with change, or they're stuck on acceptance or change, or stuck on both, a lot of times what I'll do is I'll take a look at these 5 different stages of acceptance and 5 different stages of change and see where the client is at. And if they're stuck on one of the stages of acceptance, maybe stuck on denial or anger or bargaining or stuck on depression, what I'll do is literally do some grief counseling, because that is what grief counseling is. Grief counseling is figuring out which level of non-acceptance are you stuck at. Work through that on your way to acceptance. Or maybe the client is stuck on one of these levels of change, either pre-contemplation or contemplation or preparation or action or maintenance. Once again, I've helped the client figure out which of those levels are you stuck at, and from there, do motivational interviewing. In other words, both grief counseling and motivational interviewing can be very helpful adjuncts to DBT, especially when a client is stuck on either acceptance or change. Let's review that video with a few key points. First of all, there are many polarities or dialectical dilemmas which DBT embraces. The primary dialectic in DBT is acceptance versus change. On one hand, trauma survivors desperately need to be accepted as part of their healing process. On the other hand, trauma survivors also desperately need to change, since their maladaptive coping strategies often make their symptoms even worse. Point number 2. Even though acceptance and change are different competing needs, that does not mean they are mutually exclusive. In fact, it is possible to think of acceptance and change as 2 sides to the same coin. The more we accept a client, the more we help them change. And the more we help a client change, the more we show that we accept them. Point number 3. There's no magic algorithm to provide the correct balance between acceptance and change for any given client or crisis. This ratio is in constant flux and requires clinical judgment. When in doubt, you as a therapist can use the following formula: validate, 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 skill. And the 4th point. When a client needs to accept something, focus on mindfulness and distress tolerance skills. When a client needs to change something, focus on emotion regulation and interpersonal effectiveness skills. Sometimes it can be helpful to use the stages of acceptance and stages of change models to help figure out where exactly a client is stuck on either acceptance or change.
Okay, so we've just explored the intricate balance between acceptance and change in the context of DBT and trauma therapy. Today's discussion highlighted the importance of accepting trauma survivors while simultaneously encouraging change in their coping strategies. We dissected how acceptance and change are not mutually exclusive, but rather complementary forces in therapeutic work. Dr. Reutter's insights into the practical application of these principles, including the use of mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness skills, are great tools for any therapist. Remember, finding the right balance between acceptance and change is a dynamic process that requires continuous clinical judgment and attunement to each client's unique needs. The strategies discussed today, including grief counseling and motivational interviewing, can be particularly effective when clients are stuck in one stage of acceptance or change. Knowing the forefront trauma therapy skills isn't just about expanding your expertise. Imagine the feeling of confidence and fulfillment as you help one trauma patient after the other get back on their feet and finally feel like themselves again. Our new trauma training pathway, proven ACT, DBT, and PE techniques will help you gain the confidence and skills to tackle even the most complex scenarios in the world of PTSD and trauma. With our three-dimensional approach, you will get a comprehensive training in acceptance and commitment therapy, dialectical behavioral therapy, prolonged exposure, plus a bonus on trauma-informed stabilization treatment to enhance your therapeutic skills and upgrade your clinical practice. Enroll now and earn up to 30.25 CE credits on completion. If you're a psychologist, counselor, social worker, physician, or nursing professional, these credits are accepted by your professional board. You can click the link in the show notes to learn more about accreditation and the training. You can also access exclusive content which isn't covered in this podcast. This is an on-demand training, and all modules are available in multiple formats. You can watch videos, listen to audio, and download PDF transcripts. If you enjoyed the podcast, please help us to spread the word by leaving a review on Apple Podcasts and talking about it on your social media. We truly appreciate your help. Thank you for listening. This was Dr. Jessica Díaz. See you soon for the next episode. Bye-bye.